Hello and welcome to Crushing Doubts Q&A every Monday, 6 p.m. Eastern, 3 p.m. Pacific. I'm glad to be here with you as always to talk about all the mind-body questions that you guys may have as we go through our system and figure out how to make sense of it all. I was just in a membership group today, and one of the main things that I do keep sharing is, first of all, I come more and more clear, even on my own theory and what I think about it as we go forward with things. And the fact is, as we talk in the membership group, one of the main things that I've noticed is you can really kind of simplify this down to you just need to understand it. As silly as that may sound, that's actually what we're trying to get at. How do you understand what is happening to you? How do you describe it? How do you think about it? And through that understanding, what do you do about it? It's actually as simple as that. I'm not saying it's as easy as that because it's not necessarily so easy to do, but the columns make it easier, they make it more organized, and we keep looking at the different process to figure out what is happening in a given moment. Remember your moment-to-moment being, so we're always trying to figure out the moment. Okay, we're going to dive in here. We have people on YouTube, we have people on Facebook, we have people on Instagram. So let me know your questions. I see Lucy is on Instagram, and Karen Isaacs, good to see you on YouTube. So Karen says this, I'm kind of obsessed with people's symptoms of COVID. Well, Karen, I can totally understand why for multiple reasons, but I think what you're saying, which is certainly something that I've been thinking about, is how do we distinguish what's a mind-body symptom from what's a symptom of COVID? It's a very nebulous territory some of the time. Some of the time it's pretty clear. You know, it's like a COVID symptom that's just very typical and it runs its course in the exact same way. But we have different strains also. The Omicron variant, for instance, does not have the respiratory problems. It has upper respiratory stuff, but not, in your chest, and seems to be significantly less dangerous, partly because of that. I'm certainly no expert on COVID or on those symptoms, but I do know that one of the things that can happen is people can not be sure what comes from what. And it does make it a very big kind of mind-body minefield, I would say. So, Karen, if you have more to say about it in specific, happy to dive in and kind of look at those things. When my kids did have COVID, I had completely mind-body symptoms for sure. I had some chest pain, I had some shortness of breath, and I knew it, but I couldn't entirely stop it until I actually talked to my doctor and was like, I'm testing negative, I'm having these symptoms. Is this likely to be anxiety? He said yes. I, like anyone else, am going to need reassurance sometimes, and that's an action step. Sometimes you take it at the right time. As long as it helps to bring down doubt, it's a good thing. Okay, I see Put Pain in the Past. That's Rita. Good to see you here. And Feel to Heal Coaching has joined us on Instagram as well. Good to see you. All right, Mira, you have a question coming from the YouTube side of things. Mira says, hi, Dan. How do you stay in power when your symptoms have plateaued? It's become much of a conditioned response for me. I'm overall better than a year ago, but still have a lot of the same symptoms. Okay, let's leave this up here, Courtney. There's a lot in this one. So here's the thing, Mira. First of all, when your symptoms have plateaued, it means you're not in power just in and of itself. Definitionally speaking, that's what the power column is describing. So the way I would think about this is not so much that you've been in power and plateaued. And I mean this is good news. The way I think about it is you never have gotten to that power point that I want you at. Not quite yet. You may have made power column gains. I'm sure you have. I know we've reduced doubt. I know you've made use of the emotions column system. But the thing that I found more and more is that as your doubt comes down and you get into what I would now call, I've started to call the maintenance phase of doubt, where you've really conquered the 3 levels of doubt mostly, but doubts are going to pop up because remember, doubts never stop coming and you're just maintaining it. You've got that. You've got your emotions column where you know your themes and you can use them for acute onset and upticks and symptoms. So you've got the acute onset and uptick in symptoms and the chronic side kind of managed. When that happens, you're always going to come to the same point, everybody is, which is, can I be powerful or not? And if so, how am I going to do it? And so, Mira, I would say that even though you say you're overall better than a year ago, but you still have a lot of the same symptoms, This is exactly what the power column is all about. It describes this exact situation when you've plateaued, when you've made lots of gains, but you're kind of staying in the same place. That is an indication that there is some kind of conflict or fear with power. So it's not actually about how to stay in power. It's actually about how to get in power. Let's keep talking about that. Such an important question, not just for you, but for the group at large. Because ultimately, when it comes down to it, we all need to be comfortable being in power. And that's a lot easier said than done. So, and I can share more with you, Mira, or anybody, about what kinds of things go on there and what we need to be thinking about. Okay, Mark Campbell, he's saying, hi, good to see you. Karen did a follow-up on her observation about COVID. She said, yes, and I'm scared of getting it. Yes, I'm vaxxed, boosted, and no, I'll be healthy. I've been back to being home, hardly go out. I swam yesterday because I had to get out. I don't want to be scared of getting it. So, Karen, I totally get this. This is one of the main challenges that people are facing is the fear of getting it. But part of what you're talking about, which I think is great that you're voicing it, is that even when we know kind of intellectually that we really should be fine, almost certainly, it doesn't stop. Remember, TMS or mind-body issues, if you're 99% sure that it's mind-body, you're 1% not sure. And that's good enough to make you doubt. This is the same thing. We've got to get you to a point where you feel that you can be certain, I was going to say certain enough, but that kind of runs against my point. You need to be certain that you're actually safe from this. And we can talk through kind of the statistics. We can talk through the Omicron variant and how it's playing out. I hope it's helpful for you to hear that I was boosted, was around kids who were COVID positive, and I never got it, and my wife as well. So it does seem like if you are recently boosted, you're in very good shape to not get it. But as always, when I'm dealing with a problem, I want to get more specific about it. So I want you to articulate that fear. Remember, fear is a form of doubt. Let's get it articulated. What? I know it sounds silly, because why would you be scared of getting COVID? Of course, many people are. But why specifically? Let's get at that, Karen. See if you can voice that. Okay, hi, Dorisa. Good to see you. Napoleon, good to see you too. Mira said, great help. Thank you. My pleasure, Mira. We will work at that. You're right at that point where you're about to break through really to the end of it all. End of it all meaning you'll move into the power column and be able to use all three columns. Once you can do that, the symptoms are really under your control much more. So that's up next. Okay, Rita says, hi, Dan. Hi, Laura. So she must know Field Heal Coaching. That must be Laura. Good to see you both here. Okay, Bob said, what could one add to help end a new 2-week-old EQ that has no doubt about it, just anger? So that's emotions question, I think. Actually, I'm not sure. Bob, you'll have to voice what you mean by EQ. Let me make sure I understand that. But let me read it through and see if I can figure it out. So he said, what could one add to help end a new 2-week-old EQ that has no doubt about it, just anger? I think it is emotions. Daily visits to core narrative / emotional column and continual daily routine as A steps. What could one add? I think he means questions. Those are the questions that are designed to get you answers, whereas B questions are designed to make you doubt. They come from doubt. So he's asking, all right, what do I add to it? So I'm going to take you through how I would think about this, Bob, and this is good for everybody. Every time we go through a question for one person, we go through it for all, because we're all trying to understand the exact same system. If you have a 2-week-old symptom that's coming from the emotions column, and you know that, the onset was there, the doubt is wiped out, but it's just anger, then what it means is we've got to get more specific. That's the part of the step we'd be on. So you know the column, you know the kind of broad theme it sounds like, but maybe not. Maybe you need to voice the broad theme. What are you angry about? And then get more specific. To me, Bob, that's the key. I understand you're wanting to potentially rely on like a specific technique, or not even technique, but a specific part of my system to go to. But instead, try to think about the progressions that you run through. And the progression that you would be on is either figure out that broad theme if you don't have that, or if you do have that, get more specific. That is why this symptom hasn't gone away yet. Although I would ask you, if it has reduced some, it means you're in the right ballpark, but you haven't got the specific down. And if it hasn't reduced at all, you might not even be in the right ballpark yet. You might need to be looking at that broad theme again. Okay, again, it's Pinelopus or Penelopus. I don't know. I keep saying it wrong, and one of the others wrong. So let me know. But she says, Happy New Year, Dan, and it's good to see you here. Thanks for being here. Scotty Styles, good to see you. Thanks for saying hi. Okay, we've got Napoleon, and Napoleon says, I had a flare-up and went to the doc because a couple of tests and one bleeding hemorrhoid, because of a test and one bleeding hemorrhoid. She I think couldn't find anything wrong for now. Looks like there's a typo there. Told me that the LBS sensations can come from the spine and nerves. Okay, the second part, sometimes still. Since I went, I feel more calm and I don't have it's IBS, sorry. I was going to say LBS. I don't know what, that's pounds in England. But he says, since he went, he felt more calm and he doesn't have IBS symptoms today, but has a lot of upper back pain. But my question is, with IBS, still, do diets help? Okay. Let me sum that up again because I read it in a choppy way. I apologize about that. But he's saying he had a flare-up. They couldn't find anything particularly wrong, but he was trying to figure out IBS and where it comes from. And once he got that reassurance, the IBS got much more under control, but then he had back pain. But even so, he's asking about, does the IBS relate to diet, essentially? So Napoleon, let me know if I didn't have that exactly right. The way to think about this is, first of all, when you got that reassurance, doubt went down and the symptom imperative kicked in. Now remember, the symptom imperative is when another symptom takes over where one left off, because the function of the symptom is still needed. So it just chooses a new symptom. That's what happened there. If you keep working at those symptoms, it cycles through until doubt kind of falls off a cliff. But your question goes back to the original symptom you were having about IBS. So do diets help? As is often the case in my system, and one of the reasons I think my system works well, is that it does start from an answer of it depends. It takes into account many different aspects. But the good news is it hones it down very, very quickly. So it takes every scenario and considers it and helps you have a place for that in your consideration. But very quick ways to bring down all of those questions and narrow down what it is we're looking at and when we are going to be looking at it. So in this case, we've kind of got it narrowed down to a very specific question. Does IBS get affected by diets? Usually that's not going to be the case. IBS, as defined by the way the doctors say it, is always mind-body. It is a mind-body symptom. Can you have some kind of gastrointestinal symptom that is not IBS or maybe affected by diet? You can. I was just consulting with somebody who has celiac disease. I'm not sure about the disease, the way of phrasing that, because I never feel super comfortable with that, because I don't totally know if it is an autoimmune issue coming from a mind-body issue first or not. But it can cross over into something that needs to be treated medically. Crohn's disease is like that as well, where it can get quite severe. So I was consulting with the person who was reaching out to me about celiacs. And we consulted with Dave Clark, who is, I would say, the leading mind-body expert in the gastrointestinal world. And Dave confirmed for us that, listen, if you got a diagnosis of celiacs that relates to the findings of the bacteria in the system, there are times where eating all that gluten can be dangerous. Remember, these are extreme situations, These are situations that doctors can know about very, very clearly, which this is a hard thing to delineate because they will say they know things clearly, but they've been debunked. This is one of those situations where if they say it's clear, you can go with it. And how do I draw the distinction? Is it life or death or not? Doctors are actually very good at identifying life or death issues. Listen to your doctors about those things. If they're saying, oh, this is very serious, you're going to have pain your whole life, that's complete nonsense. It doesn't relate to life or death. They're not good at evaluating that. So I would say, since you've been diagnosed with IBS, it's very unlikely that diet is going to help that. I think what's going to help is using the columns, Napoleon. Use the emotions column to figure out what feeling you're having that's leading to that. And notice the fact that you're asking, does diet help? You're working in the doubt column right there, because you're essentially saying, I don't know. Maybe it comes from diet. Maybe it's mind body. At a certain point in my recovery, after reading Sarno, I actually asked myself an important question. Do I believe in this or not? As silly as it sounds, sometimes that question is very helpful, where you can just say, let me break this down to its essence. If I believe in mind-body symptoms, I got to believe in them fully, not, oh, they come and go, or yes, it's a yes here and a no there. Mind-body symptoms are a very dominant feature of life. They're there all the time. And unless it is a life or death thing or a blunt force trauma, which heals, you can rely on the fact that it is a mind-body condition. So in your case, Napoleon, I would be surprised, unless I'm missing something about the medical diagnosis, that your diet shouldn't help with that. What can help with that is the columns. Shrink your doubt, figure out what the emotional experience is all about, and get specific. All right. Karen says, thank you as always. So she's returning to the COVID discussion. Boosted in November. I'm scared of not feeling well, but I've had so many days in my life of not feeling well, and I survived. So Karen, here's the way I'm thinking about this, and you tell me if this is helpful to you as a way of thinking about it. Because remember, that's ultimately what we're looking for, is helpful ways of thinking about it. And I do see we have some questions on Instagram. I'm going to get to those in a second. Scotty, Chuck Brown Productions, that's Terry. Good to see you. And Good Enough Housewife, thank you for joining us. So back to Karen's question. We have to look at, well, how are we going to feel about if symptoms come up? What's our system? How can we feel confident that we can master a system? To me, this is doubt convincing you. I don't know if you probably haven't thought about it this way. There's a doubt to get articulated here, guys. The doubt is, if I do not feel well, doubt will become too strong, and I won't feel well too much, and I won't be able to get back to it, or it's just going to be too horrible. That's all doubt right there. I don't blame you at all, Karen. Don't blame you in the slightest. But what I want you to think about is, if that's doubt, then you can push back on it. Then you could actually kind of make a statement to yourself that's more along the lines of, even if I did get it, so much of it would have a mind-body component that I actually can direct how bad it would get. And so I'm actually in a really good place. Nothing that bad can happen to me. Now, with me saying that, that's just me saying it. It doesn't mean that you believe it. And saying it is not the same as believing it. We've got to get you to actually believe it. But the thing I want you to think about, Karen, is that this is actually doubt in action. And in fact, you're kind of working with it already. You're saying, but I've had so many days in my life of not feeling well and I survived. That's you countering doubt right there. So this is just doubt climbing in. And believe me, doubt is using COVID. It uses everything it can, and it is using COVID to every effect it possibly can. Karen, let me know if that's helpful to you. And then Bob, I do see your answers about the symptom. I'm going to get back to you. Karen did say, yes, always spot on, Dan. Yes, I also know if I did get it, I can feel fine. Yes, doubt in action. Okay, glad to hear it, Karen. It's very helpful to pinpoint what it is that is operative here. And that's where the columns come in. There's only 3 columns. And one of those 3 columns is dominating any given moment. In this case, Karen, definitely it's the doubt column. Of course, it relates to fear, so then in some ways that's obvious. But when you get more specific, it becomes even more obvious that it's true, and an even more useful application, because the reality is you are getting convinced that if you did get it, you wouldn't be able to handle it. That's doubt also. You would. you would be fine. I hope that's helpful. Okay. Scotty Styles says, my foot pain has definitely reduced over the past 3 months. 100% TMS. Glad to hear it, Scotty. Took time to get there, but can be done. Reducing fear and doubt was the key. Great. Now that the pain is gone, I have been having more depressed and anxious thoughts, but I know this may be the symptom imperative. Okay, I'm going to take maybe out of there. And if I can be helpful to you, Scotty, it's definitely the symptom imperative. Then he says, or also that it is January in Canada, also in another lockdown. Yeah, so we're emotional beings in addition to the moment-to-moment beings. In fact, they run very tandem. One of the reasons we're moment-to-moment is because we are emotional beings. All of those things can be affecting you, for sure. But I want you to think about it this way, and this is something that I'm coming to more and more. Everything is a symptom. Anything you feel, it's a symptom. If you're feeling worried, it's a symptom. If you're obsessing about things, it's a symptom. If you're feeling frustrated, it's a symptom. If you're feeling pain of any kind, it's a symptom. If you're feeling any kind of discomfort or feeling sick, it's a symptom. Now, of course, there are medical issues that need to be treated medically, but mostly that's not what we're dealing with. The mind-body experience is so dominant, and it happens so often, that well over 99% of all experience you have, even higher than that, 99.9999999%, is going to be mind-body, because you will have thousands of them in any given one day. How often are you sick in a year? I don't know, once, twice, hopefully not more than 3 times. It can happen, but even so, some of that might be mind-body in nature. So try to remember everything is a symptom, and that's why the symptom imperative is so powerful, and it's so useful for the defense. It can just go to another symptom. There's always another symptom. Oh, okay, now you're going to itch. Okay, now you're going to feel like your eyes hurt. Okay, now you're going to feel like, you need to swallow too much. Or now you're going to feel like your knee hurts. Or now you're going to feel like your skin is sensitive. It's just going to cycle through. Chase doubt off a cliff. Do that with depression and anxiety too. And don't see, when you buy into the idea that, it's because it's January in Canada, which I granted that would be tough because I know up north it gets dark a lot earlier. It doesn't help. The fact is you can have no symptoms, including depression and anxiety, even when that's going on. It's all about pinpointing it. Use the columns, Scotty, and it sounds like it's been working for you. All right, back to Bob. So Bob was saying, let me see. I got to back up in the experience we were talking about. So we were talking about getting more specific with that 2-week-old emotions column issue and noting that there isn't doubt, but there's just anger. And then he said, equivalent, angry at the symptom. Aha. Okay. So being angry at the symptom is definitely something that happens all the time. I remember when I was having back pain, there was a part of me that wanted to cut my back off of my body. I was just like, just get it off my body. I don't want to have those sensations. I don't even want to have the nerves. I don't even want to have the nerves be active. That's how mad we can get. So Bob, the anger at the symptom is actually coming from doubt. I know you're saying, it's emotions and not doubt, but listen, all of the rules of thumb of the columns are pointing to that this is a doubt column issue. Why? It's lasted longer than, a couple hours. It's gotten into a phase where there's got to be some doubt because it's lasted 2 weeks. And when I think about anger at the symptom, why would you get angry at the symptom? Because you, at some level, have started to believe it's not going to be able to be made to go away very easily. That's where the anger comes from. It's not. I understand you could be angry at it just being there, but if it was only there for like 5 minutes, how angry would you be? The longer it's there, the more angry you naturally would be. But the reason you get angry is because it scares you. It doesn't give you any sense that it's going to let up. So this is actually a doubt column. I want to redirect you to the doubt column as the primary thing here. Bob, let me know if that's helpful. I definitely think it will be if you think about it that way. Okay. I'm going to get to your question in a second, Terry, and she says, hello, good to see you, and Sensible Goddess Coaching, good to see you here on Instagram. First, we have an observation or something sharing from Molly. Oh no, she says, I am super bummed because my burning tongue came back. but I know it will leave again. Okay, this is great to hear the second part. Obviously not great to hear that your burning tongue came back temporarily, but this is a great opportunity, Molly. When you conquer this a second time, and I do say when, because it's only a matter of time, you've already done it. When that happens, you'll be even more powerful. When you conquer it the second time, that's when you become the most powerful, because the doubt goes way down. You know, at some level, doubt can try to convince you, oh, maybe it was a fluke. Not if you do it again. And once you do it again, it'll even extend to other symptoms. So let's talk about it, Molly, but use what you used to get past it before. My question to you is, what doubt came in here? Because doubt is always trying to creep back in. You didn't have the burning tongue for several weeks at the very least. I think it was 6 to 8 weeks, something like that. We need to think about how did doubt creep back in just a little bit. That could have been that an emotions column issue led to the symptom popping up again, but then doubt takes over if it doesn't go away right away. So get right back to the doubt part. Okay, Molly says IBS is almost always the brain. I totally agree. Again, it's usually with gastrointestinal stuff, if it is something that could be life-threatening, like with the celiac issue, Dave Clark was saying, listen, it could be dangerous to you to eat gluten. Very, very extreme circumstances. What we have going on right now is everybody's getting diagnosed with this. And of course, not everybody has this, not even close. All right, Dorisa says, booster only gave me a sore arm. That's good to hear. And Mira says, have you been able to help anyone with a fistula? Okay, now this is one of those times. Where I have heard of a fistula, but don't actually remember what it is. The reason I often don't know what these things are is I don't tend to think in terms of medical diagnosis. I think of everything as everything's a symptom. So, all I have to do, I'm going to do this right now. I'm going to Google what is a fistula. Okay, an abnormal or surgically made passage between a hollow or tubular organ and the body surface, or between two hollow or tubular organs. Interesting. Let me just do a little bit more research into this. Part of the reason I'm showing you this is that you don't even have to know these things necessarily. What you can do is look at what it is and then consider, could this be a mind-body thing? Okay? So right here is what is the main cause of a fistula. Fistulas are usually caused by injury or surgery. Now, keep in mind, when I'm reading this, I don't know where I'm getting this from. Not yet. But I'm just taking in the information to get me oriented a little bit. So fistulas are usually caused by injury or surgery. They may also form after an infection has led to severe inflammation. Inflammatory bowel conditions such as Crohn's disease and ulcerative colitis are examples of conditions that lead to fistulas forming, for example, between two loops of intestine. Okay, so just to let you know, Mira, the way that I'm thinking about it right now, whenever I don't know these things, the first step I would take is to consult with a medical doctor about it, to kind of ask the question, is a fistula something that can happen from a mind-body perspective, or does it have to be treated medically in some way? So I don't know. The short answer to your question is no, I have not been able to help anyone with a fistula yet because I didn't even know what it was. I didn't even remember what it was exactly. I have heard the term before, of course, but I had forgotten. That does not mean that I can't help with that. It more means that we're still at the stage where I need to find out more about what that is. I need to find out what doctors would say about it. So, she says basically an abnormal vessel to an organ. Okay, but the question, Mira, I think, is what symptoms does that condition bring up? What symptoms are getting attributed to that supposed abnormality, or maybe it's a known abnormality? Because maybe it doesn't bring up anything. Oh, put pain in the past, says King Louis the Fourth had one. I had no idea. Actually, that does sound familiar. Casterbridge and Rhonda, 1971. Good to see you on Instagram as well. So, Mira, the way I would analyze this is twofold. One, what's going on medically? Does anything need to be treated medically or not? And then secondly, what symptoms are coming from it? Because a lot of times they'll attribute certain symptoms to this That's totally erroneous. I thought it was Louis the 14th. Okay, not Louis the 4th, Louis the 14th. I stuck to my Roman numerals very rigidly there. I thought you meant Louis the 14th, but thanks for saying that. Okay, so Mira, let's jump back to fistula if you want to talk about what you know about the medical side and what the symptoms are. Okay, Sylvia, good to see you here. What about pain that moves around? For example, I only know a migraine is ending when I feel pain on the opposite side of the head. It almost never fully goes away, just moves. Hard to tell onset and uptick. Okay. Movement is still a sign that doubt has come down. And essentially, we could read it as then, since doubt has come down, chronicity has come down. Because remember, I don't really believe in chronicity. I believe that it is consistently acute. Movement for any symptom that has been lingering, either a recurring one or one that's always there, movement is good. What it is a sign of, Sylvia, is it's a sign that whatever was going on emotionally or whatever level of doubt you had is leaving enough that the symptom's going to start to resolve itself. Your brain knows this. And so when it senses that movement, it's like, we're near the end. This is good. And then you relax, and that helps you get better faster. So ultimately, it's really about belief. What we could do, Sylvia, for you is get you there much faster. Instead of feeling like you just have to wait for it to move, and then you could feel confident. What if we could get you the confidence right away? If we get you the confidence right away or soon after, then you could actually have the symptoms start to shift when you say, instead of waiting for it to calm down. Sylvia, let me know if that makes sense. Okay, Patty Martin says, my husband just said you look like Aaron Rodgers. I've actually heard that before, although the funny thing is people say that I look more like Aaron Rodgers when he has his helmet on, which I don't know what that means. I think what it is that it frames his face in a certain way that looks more like me. I assume that I don't look like a guy with a helmet on. That's my hope. But I have heard that before, Patty. Dorisa said, still get energy drains. Any ideas on what column that would be from? Okay, so Dorisa, first of all, we need to figure out what column is the primary column that is leading to the energy drains. Energy drains are an onset or uptick in symptoms, so that is going to be an emotions column event. But it looks like I'm still making Courtney laugh about my Aaron Rodgers line. The energy drains themselves are emotions column. But the fact that they are a recurring symptom over and over and over, and you're saying, I still get them, there's doubt in there. Do you hear the doubt, Dorisa? It's kind of like you're saying, I don't know if I'm going to get past this one. I don't blame you. I'm not criticizing for it at all. But if you hear, I'm still getting these, that means there's doubt. There's doubt about, will I get rid of this symptom? We need to be ferocious with doubt and really, really push past it. All right, let me make sure I did miss a question. I was supposed to get back to Terry. Okay, Terry. She says, if you're in the middle of a flare-up, waving hand over here, and it's the second or third day, is that more of a trauma thing rather than looking at a column? If so, how should one treat it? Okay, a couple things. So first of all, in terms of trauma usually doesn't last that long. The most trauma usually lasts in its most active form is about a day. Trauma can get reactivated repeatedly, so it seems to never end. It's just like the consistently acute idea. It can go on and on and on if it keeps getting re-aggravated. But I would say that if you're in the middle of a flare-up, first of all, I'm sorry, I know it's no fun, and you're at the second or third day, then it speaks to, really, to me, one of two things in that time frame. I wouldn't call it trauma, although it could knock you into trauma by itself, meaning you're afraid of it or you're having a bad experience with it and you're worried, okay? But if you're in your second or third day, it's starting to bring doubt in for sure. Because if you get past even a couple minutes, doubt starts to have room to play. So I want you to work in the doubt column on it. However, I also want you to check very carefully for the emotions column. Is it possible that you have missed the key emotion that was the symptom? I had this happen recently. I was having pain, and it went on for a couple of days, 2 or 3 days. And I thought, I've been through all of the emotions column stuff. It can't be that. And I kept working at the doubt also. So I was like, I don't know what it is. This is so weird. Well, listen, if you've managed your doubt and you're not feeling in trauma, and remember the signs of trauma are like, foggy brain, it's funny because I'm not thinking clearly right now. That's one of the signs of trauma. But anything where you can't be in the present moment, or where you feel like you're in danger, or where you feel desperate for something to get better. So assess whether you're in trauma, Terry. I don't know. You could check it. I don't think that's the driving factor here, though. In the situation I was talking about, I checked for doubt. I pushed back very hard against doubt. And once you've done that, once you're not in trauma, or you're pretty sure you're not having an active trauma moment, and you've pushed back against doubt, then you can be pretty certain that that flare-up is an emotion that you didn't catch the specific of. And you go back to it. That's what happened to me. I went back to the timing again. I started over in the emotions column and said, I missed it. I went back to it, checked it out, and I found it. Boom. Suddenly I realized, here was a major issue, and I had not seen it. The minute that happened, my pain drained away. Okay, sorry it took me so long to get to that, Terry. I almost missed it. Okay, E.T. Bull has joined us. EMC, good to see you too. Then Terry's elaborating. Sorry, I meant trauma response to pain. Got it. I think the straw that broke the camel's back, I almost said. I think the straw that broke the back was emotion. I buried that hole, but I think it was a buildup. Was aware of the emotion, but couldn't feel it. Yep. And as soon as you get specific about that, it's going to come down. And if you get even more specific, it'll come down even more. If you get partial relief, you got a partial answer. If you got full relief, you got the full answer. Okay. Bob says very helpful. I'm glad, Bob. Thank you. And Molly said, hey, did you see The Nightmare Before Christmas? I didn't. I've been concentrating on editing the book ferociously, but I will get to that soon, and I appreciate it. We have a question coming in from Facebook. Okay. This is from Ryan Edson. Ryan, good to see you on Facebook. Common law relationship ended a year ago by my partner. I have had no contact from her for a year. I still have grief and loneliness, which brings on symptoms. I daily have feelings of reconnecting, but don't want to get hurt more. How to get unstuck and move forward in my life, like dating again, for example. Okay. First of all, Ryan, my heart goes out to you. It can be very, very hard. I was shocked, actually, in my life when I had breakups at how incredibly hard it was. It was one of the hardest things I have actually gone through on 2 different occasions. And it actually often doesn't matter whether you ended it or the other way around. It can just be so hard. From a columns perspective, which I'm going to try to keep it limited to because it's most useful for our discussions here, but also because I find the columns really do apply to everything. From a columns perspective, what's jumping out at me is the power column. This is more than a year, so it's not emotions column. Emotions column, that comes and goes very, very quickly, very moment to moment. There may be some doubt in there about whether you're going to feel okay or not, but that's also secondary. To me, the primary column here is power. Do you feel you're having a good relationship with yourself right now? Do you feel that you're valid, that you have worth? When you have a breakup, it can really put a ding in that feeling of value of yourself. So what I would recommend, Ryan, is do some power column work. See how this breakup and the loneliness and all of it fits with your core narrative. See if you can figure that out. How is this relating to it all? Once you figure that out, you'll have a clearer picture. And then you can start to ask yourself the question, what's the powerful move here? The powerful move might be to reach out and reconnect. The powerful move might be to say, as sad as it is, I'm going to actually move on. It could be anything in between, but you want to start thinking about power here. Hope that's helpful, Ryan. Let me know. Okay, Molly says to Mira, our granddaughter is gluten and lactose intolerant, but the doctor said most children outgrow this. That's what I've heard as well. Molly also said, I'm going to Google Aaron Rodgers. And then she said, but Aaron is a girl. She spelled it E-R-I-N. All right, A-A-R-O-N. I know you knew that, Molly, but let's see what you think. And look at a picture with a helmet and without. We'll see what you think. Okay, Sylvia said, thanks, Dan. Interesting. It's moved around like this for years, even before I discovered TMS, but I still think your explanation makes sense. Yeah, see, remember, your brain knows everything that I'm telling you. I'm just translating it. I'm telling you what the brain does. I'm not telling you I invented a theory and now your brain's going to start doing it because I told you. I'm describing what already is. The brain already knew this. So from an unconscious perspective, the brain actually knows. I mean, it probably doesn't organize it in terms of the columns. That's a human invention that I created. But it does know what's causing what. It knows that a feeling can cause symptoms. It knows that doubts can cause symptoms. It knows that a lack of power can cause symptoms. It does know this. It just doesn't think about it in those terms, I don't think. If it does, then I'm really hit on something great here. But I think the key is to think about the fact that your brain has already known this. So factor that in. Okay, Good Enough Housewife says consistently acute versus chronic, super helpful. It is a massively helpful idea. It's the thing that I describe as breaking chronicity. Put it together with moment-to-moment experience and recognizing that something that seems chronic is actually just consistently acute, always there, but always could go at any given moment. And boom, there is no chronicity. There isn't. It can be broken at any moment at all. Okay. Sylvia said, I noticed the pain moved this AM this morning after I felt like I mentally talked to the pain and maybe resolved some things. But also sometimes it moves and is much worse on the other side. But then I tend to treat that as an onset or an uptick. Sometimes it's hard though, when it starts out mild, then gets worse with time. So Sylvia, here's a nice rule of thumb that can help you. If you're not sure what to do, go crush doubt. Doubt is the linchpin of everything. If doubt is there, it rules everything. It doesn't even matter what's going on from the rest of the columns. If doubt is there, it's going to rule the day. The only thing that can go above doubt and dominate everything is trauma. If you're in trauma, it's like, the highest form of doubt because it's massive fear. And remember, fear is a form of doubt. But again, that's just doubt. Doubt, again, dominating in extreme form, but it's doubt dominating. Okay, we've got another question from Facebook and Ryan, and it looks like we will probably wrap up here for tonight. But Ryan said, thank you, Dan, for your response. Grateful for your work. Also, will your book be a replacement for the PDFs, or should I buy the PDFs now and the book will be an added resource? Okay, thank you for that question. That's very, very, it'll help people get clarified on this. I've had that question myself as I've been writing this book. I was thinking, am I going to make the PDFs essentially obsolete? The interesting thing is, no, and it's not even on purpose. It's just because each thing I've created for the sufferers out there in this community and anybody who wants to join the community, I've put out new things that address a different problem. And the PDFs address a different problem than the book. So the PDFs, for example, let's take the 3 columns PDF. The 3 columns PDF, it gives you in a 3-page, I think it's 3 pages, something like that, 3 or 4 pages. It gives you direct instructions. It's like a shorthand on how to build out your columns and do your mind-body map. That's its own thing. And some people are going to work better with that than they will with the book because the book has everything in it. The seminars are designed to get you all the information you need in one lump so that you can stop searching for information everywhere else, convince you don't need more information. The groups are about moment-to-moment experience where you go through it in an active sort of way and practice it. The book will be the thing that describes everything all at once. And it's kind of like the closest thing the book is to is actually the seminar in a way, because it is, it captures the whole picture. But the book has even more to it in certain ways and less in others. The seminar is very targeted. There's a way of doing it that gets you information fast and fully and convinces you of things. Whereas the book gets the whole picture. It also brings in a lot about me personally, so you can see the journey and the evolution of the columns. So the fact is, all of these resources do different things by design. or I wouldn't be making them. I only make things that I think are useful to you guys. Now, it is true that I also wondered, well, I made these PDFs before I had the book. I needed to get people answers in written form, but it turns out they're different. They really are. Let's take action steps too. My action steps chapters go through things, and they take you through all of that, but more in paragraph form, in words drawn out. For some people, the action steps list is going to be great because it's just a list. You don't have to deal with the words and how it's being presented in the whole system. It's just boom, straight to the point. So the PDFs are going to continue to be useful. So Sensible Goddess Coaching says, what's the website again for the PDF? Thanks. Oh, she said she found it, but I'm still going to tell you because other people will want to know. The website is www.crushingdoubt.org. You can go there. You can sign up for my seminars. We are going to get another seminar up scheduled soon. It's going to be the beginning of February, I believe, but I will get that date for you. It's always Monday through Thursday for 2 straight weeks. I'll get you that information. That's going to be on the website. There's lots of things that are going to be on the website, though. You also can join the group memberships there. The success we're having in the groups is really, really exciting. I'm finding that it's a big missing link, as the book will be as well. They all were, all of these different resources. But when I would do the seminars, people would feel confident then, but then they wouldn't get to continue it. And I knew I had to build something that would do that. Well, that's what the groups do. So you can sign up for that on the website as well. We will be getting what's called a click funnel on the website that's basically helps you, click on the links and go where you need to go to get the book, to pre-order the book and all that. And I look forward to that. The timeline to me looks like I'm going to finish the pre-edit, which is where I edit it before it goes to an editor, which is important because nobody can help me with a theory because I invented it. So I need to make sure everything's in there before an editor gets their hands on it. Then there will be an edit, and we're hoping the book will come out in April. So I'm going to keep you posted on that. It's moving very fast now. I'm very excited. Thanks so much, guys. This was a pleasure as always. I will see you the same time next week. That's Mondays, 6 p.m. Eastern, 3 p.m. Pacific. Thanks so much. Keep up the good work. Keep working in the columns. Just focus on understanding and know you make sense. Your symptoms make sense. The columns can help you make sense of it. Thank you, guys.